Greg?
Hello, everyone. So as Renee said, my name is Greg Southard, he, him. So I am a part-time instructor at University of Akron. I mainly teach in child and family development, teaching numerous courses from child development, adolescent development, home-based intervention courses. And I'm also the clinical manager at a local practice here in the greater Akron area. We're called Navigate Counseling and Consultation Services. We specifically provide LGBT affirming care for youth, adolescents, and adults. And we also provide consultation and continuing education for counselors, social workers, and marriage and family therapists. So that's a little bit about me. So I guess I will go ahead and start my presentation, unless there's anything else that I should do before, Renee.
That sounds great, Greg. Yeah, if you want to go ahead and ready to screen share.
Okay.
And I should reinforce, he is also, because there are few of us, he is a marriage and family therapist. So an independent IMFT. And so he has an excellent background in family systems and family therapy, which will be helpful as we discuss this topic today.
Yep.
All right, looks good.
So, all right. So that's just the logo of where I primarily work, Navigate Counseling Consultation Services. Again, LGBT affirming practice here in the Akron area. So today we're going to, there's going to be a lot of information that I'm going to squeeze into 15 minutes. So it's going to be impossible for me to go over everything. So if it's a little rushed, I do apologize. But kind of for starters, we're going to talk about gender identity in youth. And one thing that I kind of like to start off with is making sure that we know how to separate what gender and sex is. One of the jokes that me and my colleagues make a lot is when people have gender reveal parties for, upcoming babies, it's really more of a sex reveal party. So when we look at gender essentially is, who we are, the roles and stereotypes that we take, that's kind of like in our mind, that's who we are. And that's kind of what makes us boy and girl versus sex. That's our biological, that's the genes, our hormones, and our body parts. All right. So just some common terminology. I'm not going to cover all these terms with you, but you might have heard of terms such as gender dysphoria. This is more of the diagnostic term in our DSM, which is the manual where we do mental health diagnoses. This can and cannot be a good thing because sometimes this provides a label or a mental health concern associated with your gender. So there's kind of mixed thoughts about it, but gender dysphoria is the clinical term. When we look at transgender, this is someone who it's more of an umbrella term, but this is someone who identifies as the sex that they were not assigned with at birth. Someone who refers to themselves with a sex assigned at birth is called cisgender, and that's more of a relatively new term. But we're going to talk a lot about gender expression and gender fluidity and so forth. But this is kind of like some of the foundation that I'll go off of as we talk a little bit about gender. So some of you might have seen the Genderbread Person already. So if you have, I apologize. This will be a little bit of a repeat. But when we look at gender, there's identity, attraction, expression, and sex. So again, your gender identity is who you are. This makes up your boyness, your girlness, your womanness, your manness. And one thing is you don't have to be one or the other. Everything can kind of be a spectrum. So you can kind of be 20, 80, 50-50, you can be any kind of combination in between. And again, this is in your head who you define as your gender based upon or what you don't align with. When we have gender expression, this is what people kind of consider to be, if you're feminine or masculine. This is the way that you're going to present who you are. And these are kind of more the physical attributes, such as your actions, your dress, your demeanor. This is how you want, the world to kind of interpret you in a sense. Again, we just talked about biological sex. This is just, again, who you are of hormones and body parts, essentially. And to not mix up anything, there is also attraction. This is who you are attracted to, whether that might be boy, girl. And again, you can be sexually attracted to sex, and you can also be attracted to gender. So it's kind of a little bit of a spread of everything. So when we talk about gender, Those who are cisgender don't really have to come out. Coming out is a process, and it is a lifelong and ongoing process grounded in individualistic Western ideals. And people have to come out for sexuality and gender when, they don't identify as heterosexual or cisgender. So coming out for some kind of has this heteronormative feel to it. And because, if you do identify as straight or cisgender, you don't have to announce your sexual affiliation or your gender identity. So this is a process that's ongoing and lifelong. It's not something that you do at one time and then it's over, because in life, you're going to meet people throughout school, work, you might change jobs, you might meet new friends later in life. This is always a process that is going to be occurring throughout life. And it is a single greatest correlative factor with well-being amongst LGBTQ folks. So sometimes coming out might have serious consequences. So one thing, I'm going to kind of start with is make sure that we never force someone to come out or that they have to come out to us. It can have a lot of anxiety of, am I safe? Am I going to lose this person? There's a lot that can go along with it. So when we talk about gender, there are some risks associated with it. So a lot of research will show that suicidal ideation were the highest amongst transgender youth and gender expansive. We have about 49%, or 40 if we're looking at more of the broad gender expansive expressions. So that is about half of those who identify as trans who might have suicidal ideation, 1 in 2, versus our counterparts with, cisgender folks, depending on male or female, that is a mere fraction. When we look at other risks, they are 6 times more likely to have mood or anxiety related disorders than the general population. That is 6 times. That is a huge number. So there's a lot of risk associated with gender identity if you identify as non-cisgender. And again, 3 times as likely to be prescribed antidepressants and anti-anxiety medications to help alleviate some of the mood or anxious disorders. And one of the worst parts is they are 6 times more likely to attempt suicide, resulting in hospitalization. So these are a lot of risk associated when a youth or even adult are not identifying as cisgender and somewhere in the transgender or non-conforming realm for gender. So as, parents, friends, people in the professional field, there are a few do's and don'ts that we can do and not do. So one thing is use proper pronouns. If someone identifies as he, him, but they might not appear he, him to you, it doesn't matter. Just use the pronouns that they provide for you. And we're human. We're going to mess up by accident because as humans, we associate what man and female is based off of our own experiences, based off of color, clothing, hair length, you name it. We're bound to mess up. So if we do, correct ourselves and just use the correct pronoun. One thing is respect one's identity. You might not understand it, and that's okay. We just have to be respectful. The good old joke that I use is, I hate chocolate. And there are many people who love chocolate. I just respect that they like chocolate, and I don't need to argue with them that I think chocolate's disgusting. I just agree that you like chocolate. And one of the things that we can always do is just ask appropriate questions. Never assume. It's okay to ask questions as long as you're being respectful about it. Some common things not to do is, use incorrect pronouns. And I'll get to another slide about that, what that can kind of do. Assume someone's gender. Force someone to educate you. If you have a question and someone's not willing to answer, that's okay. You've asked, and that's the appropriate thing to do, but we can't force them to answer. We never want to ask invasive questions about someone's body, such as if they've had life-affirming care or, what body parts they might have. That's very personal. You don't have someone coming up to you and asking about your body parts of what's underneath your garments. Again, never out someone's sexual orientation or gender identity. We might not know what kind of greater impacts this might have on someone. Maybe they might lose their friends, their family, their job. There's a lot of safety that can be involved, and especially with youth, there are unfortunately the horror stories that, sometimes youth do get kicked out of their homes, and that causes greater systemic concerns where, how are they going to get food? And that can lead to substance use and other forms of illegal activity. And language is always changing, and we want to avoid using derogatory slangs or terms in a pejorative manner. So this is something that I found online, and I think it has a powerful message, but these are 10 things that you're actually saying when you ignore someone's gender pronouns. If someone asks you to use, they, them, she, her, he, him, you name it, and you are intentionally not, you're kind of giving them one of these 10 messages, if not all of them, such as, I know you better than you know yourself. I would rather hurt you repeatedly than change the way I speak with you. Or your sense of safety is not important to me. I'm not going to read all these, but these are some of those, kind of internalized thoughts that, a youth or even adult who is trans might be experiencing, which kind of teaches them that you're not a safe person for me. I can't talk to you. You're not going to respect me. And then, that's where a lot of isolation can occur. So what can we continue to do as, educators, as parents, as friends, as people who are, in the helping profession? We want to continue to provide and connect to affirming resources, whether that is, all health services. Here in the Akron area, we have Summa Pride Clinic. We have Akron Children's, and that now has gender affirming care. We will also want to continue to educate ourselves and be inclusive. Hence what we're doing right here. We're trying to educate ourselves really quick. We're trying to be inclusive. And being respectful does not mean that you have to agree or fully understand. It just means, can you just let that person, have their life, and we might not have to agree with it, but does that mean that we have to argue? But it's okay to ask questions sometimes. And believe it or not, research does show that acceptance and support from parents and peers, so transgender and non-binary or gender non-conforming youth who reported gender identity acceptance from at least one adult, had a third lower odds of reporting a past suicide attempt in the past year. So again, when we talked earlier that there are 6 times more likely to experience suicidal ideation and 6 times more likely to result in hospitalization from suicidal attempts, just having one supportive parent or peer can reduce that by a third. And right there, that is a huge number. So again, continue to educate yourself, trying to connect and being respectful, again, from some of the do's and the don'ts that we've talked about. So again, that was a fast 15 minutes. I think I might have went a little too fast, but that's the joys of me trying to rush a 15-minute presentation. So I guess, Renee, is this kind of like the time for questions and answers?